Hello again, I'm Dr. J.C. Smith at Smith Spinal Care in Warner Robins here. Today I'd like to talk to you about honesty in healthcare. There's a legal doctrine of informed consent that is both a state law and a federal law, but I find nobody does it. But it's a law that says when you go to any doctor of any type for any problem, you're supposed to be told after the examinations are done, but before treatment begins, you're supposed to be told a few things. First, what is the nature of the problem, what your procedures consist of, and also things like the cost and the risk. And a big thing that most doctors leave out is practical alternatives to their care. So in the back pain business, obviously many people go the medical route. They start with over-the-counter pain pills, which will eventually eat up your stomach, kidney, liver, small intestine, and cause heart problems, like Advil and Aleve and aspirin and all those things over the counters. Then when that doesn't work, and it doesn't, then they go to the medications, the opioid, narcotic pain pills, such as Oxycontin and hydrocodone and tramadol. And what most people don't understand is that the reason they're so addictive is because the active ingredient is medicinal heroin. And within 2 weeks, you can be addicted to that stuff. What I find is the lack of honesty is where doctors and pharmacists are not telling people, by the way, be careful. Another thing is the research has shown that they are no more effective than taking 2 Advils, so ibuprofen. And again, they're not fixing anything. And when that doesn't work, and it doesn't, then they do the spinal injections, epidural spinal steroid injections. And again, the research calls it underwhelming because again, it's not fixing anything, it's just masking the pain. And they also, now the FDA has a warning that they can cause blindness and stroke. And they're very expensive. One fellow told me he paid $4,000 for one shot into his neck that lasted 2 days. Then of course, there's the spine surgeons who are charging an arm and a leg. The Mayo Clinic says the average cost is $77,000. And again, it's based on the debunked bad disc theory that we've spoken about in a previous segment that has been totally debunked by the Mayo Clinic and every other country of the world because they're finding bad disc in pain-free people. So whenever you go to any doctor for any problem, not just a back attack, but a heart attack, fat attack, diabetes, hypertension, whatever, after the doctor gives you his diagnosis and his treatment plan, legally, they require that the doctor, not a nurse or a physician assistant, tell you practical alternatives. And they're supposed to tell you in an unbiased way. Now, I know that's difficult because MDs are bred to have this prejudice against chiropractors. I call it chirophobia that I discussed before. But that became an issue of a lawsuit in New Jersey because a woman was not told her alternatives and suffered the consequences, only to find out later she should have been. And the Supreme Court of New Jersey sided with her, and they found the doctor guilty because he would not tell her that chiropractic was a viable alternative. And that lawsuit could be replicated by 1 million people today. Because I know when people come to see me, I do informed consent with everyone because I want them to know the pros and the cons of chiropractic versus medical spine care. Because we're so much faster, safer, cheaper, quicker, better. I'm proud to talk about this issue. But I find that I've yet to find one patient, even some that work in the medical field like nurses who I take care of, who actually understand that you're supposed to be told practical alternatives. And for those few people that are brave enough to ask, should I see a chiropractor before your surgery or your drugs? Usually they're chided by the doctor. Well, if you're stupid enough to go to a chiropractor, don't come crawling back to me when you're paralyzed. Well, that's bias, and that's illegal. Just if you've seen, I'm waiting for a lawsuit. You've seen the class action lawsuits against mesothelioma from asbestos, the hernia mesh problems they've had, and of course the Roundup causing cancer. I would love to see an attorney group have a similar kind of class action tort action against spine surgery. And all they'd have to say is, if you had failed back surgery and were not told by your surgeon to see a chiropractor first, you may have a lawsuit. That would end the tsunami of unnecessary back surgeries overnight if these doctors could be held accountable. Again, the facts show, and you can read my book if you're interested in these issues, that 50 to 90% of all back surgeries are deemed unnecessary now. This is the biggest scam in healthcare. Dartmouth 10 years ago put out a study showing that up to 50% of heart, back, hip, and knee surgeries are unnecessary. Another study just came out from Institute of Medicine like 2 months ago showing the same for heart stents and bypass surgeries. Most of those are unnecessary. But the fact is the public's gullible. They want to believe their doctor. There's just no honesty to say, by the way, you can avoid all this if you try practical alternatives. For spine care, that'd be chiropractic, massage therapy, acupuncture. They even recommend yoga and Tai Chi. And again, the reason why is because they find that most back pain has little to do with bad disc. As I mentioned, the Mayo Clinic found they're finding bad disc and pain-free people. Most back pain is due to joint dysfunction. Most people don't realize it, but here's a model of the spine. Actually, this came from a patient who didn't pay his bill, so we repossessed. But nonetheless, most people know there's 24 vertebrae sitting on top of 3 pelvic bones. What they don't know is the importance of joints, whether it's the sacroiliac joints down here or all the spinal joints that connect all these and allow motion. Again, your spine has to move. And that's the thing, is when these joints get so misaligned from falls and accidents, sports injuries like what I went through, or even a forceps delivery at birth and they pull, tug, and twist a kid out of the mother. All of these add up. Bicycle falls, cheerleading. It's just amazing. They all add up, and every time you do, you're going to misalign and jam joints. What the scientists now call is the buckling effect, where the joints actually buckle. And that's what prolonged sitting does. You could have the prettiest, straightest spine in the world, but if you sit all day, you're going to buckle up these joints. So you need to unbuckle them. That's what adjustments do. We adjust spinal joints to restore joint play. But the thing is, even though that's a simple anatomical fact, the medical world is not telling people, try a chiropractor first. I've been here 40 years, and I can count on one hand how many referrals I've had from MDs. Again, they don't follow guidelines, they follow the money. Another bit of dishonesty that I'm finding is in the media. For example, that's what my second book is about, the media war against chiropractors. But let me ask you, when was the last time you've seen an in-depth, fair and balanced article about the benefits chiropractors bring to the world, that is, where back pain is the number one disability in the military, the workplace, and in general society around the world, not just in the United States? You've never seen it. And if the only time you see chiropractors in the news is something went wrong. What's interesting is that we're no small little profession. We're the third largest physician level profession in the world, only to the MDs and the dentists and chiropractors. And we're the leading non-drug, non-surgical profession. We find answers to health problems through chiropractic care, neurophysiology, which is how the nerves control function in your body. Wherever that nerve goes, you're going to have problems perhaps. We incorporate nutrition and exercise and supplements. Chiropractors do a lot more than just pop the back like some people think. If you've not been to a qualified, experienced chiropractor, you'll be in for a pleasant surprise to find out how we actually teach patients, not just treat them. But the point is that you've never heard that, even though we've been around. The art of manipulation goes back 3,000 years to the physician pharaoh, the great Imhotep. You all remember Imhotep. He was the physician of the great pharaohs, and he spoke about it in his writings. The Romans, the Greeks, Europeans, the term bone setter was coined in England in 1510, and it was then just a trade like blacksmithing and artistry or whatever. And it was the families in Northern Europe that brought it to the United States, and they're developed into osteopathy and chiropractic, and they made a science out of it to understand, well, why is it when people were adjusted, they felt better? Well, that's what Dr. Palmer at Palmer Chiropractic College basically did. He started with the first aspects of neurophysiology, how the nerves, again, control function in the body. So if someone has a backache, we adjust that. It might affect the nerves to the different organs and improve your whole metabolism, which will help your immunity, perhaps, or help your longevity. But the point is that you've never seen that on the media. It was interesting, about 10 years ago, I had a conflict with Dr. Sanjay Gupta at CNN. By the way, I later got banned at CNN, even though I like CNN. But it was about the fact that his colleague at Emory University, Dr. Scott Bowden, I've spoken of him repeatedly in my book and such, but he was an orthopedist, and now he's the director of this Emory Spine Center. He's a bigwig. But what his claim to fame was, in 1990, he did an MRI study on people with and without back pain, but both groups had bad discs. And he said, well, if bad discs cause the pain, why do the people have bad discs but no pain? Because then most back pain is joint pain. That adjustments help best of all. And since then, like I say, 32 other studies around the world confirmed Dr. Bowden's finding. That's when I mentioned before, the Mayo Clinic came out with their systematic review, and again, found that, for example, by the time you're 50 years old, there's an 8% chance you're going to have disc degeneration, but no pain. So again, don't let someone convince you otherwise. I have that study if you want to learn more about it. So I wrote to Dr. Sanjay Gupta because he works at Emory University too, in the same department as Scott Bowden. I said, Dr. Gupta, who's a likable guy, smart guy, I said, why have you never told your viewing audience that bad discs are apparent pain-free people? Like Dr. Bowden, your colleague, has shown, and others have now shown that. I said, it would save a lot of people from unnecessary back surgeries, which is epidemic now. I never got a response from him, but I did find out through my book publicist, because my book came out a few years later, and this book publicist, just by happenstance, used to work at CNN, and he knows these people. So he said, good, I'll talk to Sanjay Gupta, we'll have you interviewed on CNN. Spread the word. I said, great, that'd be fabulous. Well, he got back to me a few weeks later and said, what did you say to Gupta? Because you've been banned at CNN. I said, what I told him is what I just told you, how I suggested he tell his viewing audience that bad disc and such appear in pain-free people. But they refuse. And I dare say this is not some small little study. When the Mayo Clinic speaks, people listen. Yet, have you seen in any media? None. Again, it's that doctrine of informed consent. You're supposed to know this stuff before you subject yourself to a surgery. But if your doctor's not telling you, the medical media like Gupta and others are not telling you, how are you to know? That's the problem. Unless you watch a video like this or read books like mine or others, and there are others, people just don't know. They're really kept in the dark. As I've said repeatedly, this is the biggest scam in medicine. Because they know, and there's plenty of experts now who also talk about this. It's amazing. There are honest neurosurgeons, and many of them are actually calling for a moratorium just to stop all this. Dr. Deo, author of Watch Your Back, he's a MD, PhD, he says, calling a medical physician a back pain expert is perhaps faint praise. Medicine has, at best, a limited understanding of the condition. In fact, medicine's reliance on outdated ideas, like the bad disc, may actually have contributed to the problem. It's amazing, but Dr. Bowden, here's again, Dr. Bowden up at Emory, he said, many, if not most, primary medical providers have little training in how to manage musculoskeletal problems. I could go on and on. There's others honest, ethical surgeons who are saying this. But again, you walk into your local primary care physician, he's not going to tell you, I'm not trained in this. I tease patients. I said, you could have gone to a dentist and got the same bad advice. But these MDs are so proud and they have such chirophobia, they won't refer you to a chiropractor when that's exactly where you need to be. So I want you to keep in mind, next time you go to any doctor asking about your back problems or neck problems or migraines, stop and ask them, should I go to a chiropractor? And if they don't tell you that's a great practical alternative, then I want you to walk out of that office as fast as you can. Otherwise, I say this idea of informed consent is important. You should ask it. You shouldn't have to ask. They should tell you. And whenever you go to any doctor of any type for any problem, you need to say, tell me my informed consent options. And if they don't, then you may have a lawsuit. Otherwise, thank you for listening. I'll see you next time.